Everyone. Today we're going to talk about the nursing process. Okay, so let's see this cartoon or this scenario. In this scenario, you see the patient is saying, "Oh, my back is painful. Please, I need help. Call the nurse." Okay, so what would you do in this case that your patient is having pain? Think about it. In today's lecture, we're going to talk or you're going to learn about the nursing process. The nursing process is our thinking and our action process where we are going to solve any problems that the patient is having or the patient is saving. Okay, so the nursing process is a systematic, rational method of planning and providing individualized nursing care. Individualized means that it is different from each patient than another. It is the process that uses also to identify and manage the health problems of clients. It is also a framework of the nursing process or the nursing care. It is also an organized sequence of problem-solving steps. So it shows you or it makes you think in an organized way when you are solving any problem that it is facing. Okay, the nursing process has several characteristics. Number one, it is a dynamic in nature. So it is dynamic in nature means it can change. So there is not one set or one rule that fits each and every patient. So even if you want, for example, to give the patient the medication, okay, but then you see that your patient is having a shortness of breath, you will be acting or like you will be solving another problem, which is shortness of breath. Okay, it should be centered to your patient, so it should be, as I mentioned, individualized for each patient. It should focus on problem solving and decision making. Also, it could be interpersonal or collaborative in style. It could be universally applicable, and then also it uses critical thinking and clinical reasoning. Okay, so the steps in nursing process. Number one is assessment. The second step is diagnosis. The third step is planning. And the fourth is implementation and then evaluation. And we will talk in details about each and every one of these. So the first step, which is collection of data or assessment. So you collect data through interview, through nursing health history from the system, for example, physical examination, diagnostic and laboratory results. Okay, so these are your sources. The types of data that you should collect should be objective data and subjective data. So objective data, as we have mentioned in class, is the observable or measurable data, which is an example for that is vital signs, bleeding, weight, and skin color. Okay, subjective data, which is what the patient is feeling and can be described by the patient. So pain, dizziness, for example, I'm feeling stressed, I'm feeling loneliness, I'm feeling depressed, for example. Okay, the second step is diagnosis. So after you gather all the assessment or the data, you now have to diagnose or you put a label of what is the problem. So the nursing diagnosis is a health issue that can be prevented or reduced or enhanced through independent nursing measures. Okay, and there are types of diagnosis. So it could be actual, so that there is a problem that is actually happening, like pain. It could be a risk for, which is could be a risk for infection. It could be a possible diagnosis, which is something that the patient is not having but could be possibly that he is having this problem. Okay, and then wellness, which is something that the patient is not sick but we are caring about his wellness diagnosis. Okay, so there is a criteria or a classification system for diagnostic labels. Those are proposed by the North American Nursing Diagnosis Association, and that's what we follow in our College of Nursing, as well as many other countries in the world or in the region are following NANDA. Okay, and I will post this in your. Okay, so what are the parts of nursing diagnosis? Number one, you need to state the problem, which is the diagnostic label, and then the word related to, which is the etiology or the contributing factors or the reason why your patient is having the problem, as evidenced by what makes you think that the patient is having this problem. So the symptoms, the signs, or it could be signs and symptoms. For example, Asma is experiencing difficulty in sleeping because she is taking too much caffeine. As a result, she feels tired during the day and always irritable. So the problem here is disturbed sleep pattern. Where do we get this statement or this diagnostic label? Is from the NANDA diagnosis, okay? Related to etiology, which is, so the etiology is excessive caffeine intake. So it will be, your statement will be like this: disturbed sleep pattern related to excessive caffeine intake as evidenced by difficulty in sleeping, feeling of tiredness during the day, and irritability. Okay, so the third step is in our nursing process is planning. So once your nursing problem is diagnosed, the next step is to plan for an intervention. So planning is the process of prioritizing nursing diagnosis and collaborative problems. It identifies measurable goals. So your goals has to be measurable. So you have to state, for example, you are going to your goal is to reduce the patient pain from 6 to 2, for example. Okay. So there are types of nursing intervention again here, and it could be independent, it could be dependent, and it could be collaborative. So your intervention could be done by you only. It could be done by the patient himself, like walking, for example. It could be dependent, which could be done by you. It could be collaborative, which could be done by you and the physiotherapist or the nutritionist, or collaboration between the doctor. Okay. The fourth step in the nursing process is implementation. Once the planning is complete, the next step is to implement the plan. The nurse implements medical orders as well as nursing orders. So if there is any medication that the doctor have, the physician have ordered, for example, you have to give to reduce the pain. But there are other nursing interventions that you can do for pain. For example, heat pack, cold pack, massaging, deep breathing, for example. Okay. The fifth step is evaluation. And evaluation is very important because by evaluation you will know if your patient have if your intervention was working. Also, you will know if your patient is feeling better. Also, you will know if you need any further interventions. So you can say goal is met and you don't need to do anything. Goal partially met, and then you mention why and what you should do to reach to your goal. And then goal is not met. For example, the patient have been discharged or goal is in progress. So here a very simple cartoon to summarize everything that we have been talking about. First, assessment, which is gathering the data, and then you should analyze it and diagnose it. So you should say what is the problem or the nursing diagnosis, and then planning, and then implementing the plan, and then of course evaluating what you have done. Okay, so again, if we bring the same cartoon that we have talked about or that you have seen at the beginning of this presentation, the patient is saying, "Oh, I am in pain, please call the nurse." What would you do in this case, in this scenario? Think about it for a minute. What is your most important assessment data in this scenario? Of course, in terms of objective data and subjective data. So in terms of objective data, you will check vital signs, you will check facial gestures, you will check objective pain, rating, and then behaviors, and then subjective data, which is the patient is saying my back is hurting or painful. What nursing diagnosis would you expect based on the assessment? Of course, your patient is in acute pain. So there is a label by NANDA, which is acute pain. So you will say acute pain, and then the word related to surgical procedure as evidenced by, which is the evidence, okay, as evidenced by self-report of pain at 7/10, facial grimaces, and guarding behavior. What would be your goal now? Of course, your goal is to reduce pain, but we have to be very scientific and very specific. Patients describe satisfactory pain control at a level of less than 3 to 4. So you will reduce it from 7 to 3 or 4 on a rating scale of 0 to 10. Okay, so this would be your goal. What is your plan now to achieve your goals? Of course, get rid of additional stressors. It could be by providing rest periods. It could be by administering pain medication. It could be by providing cognitive behavioral strategies, such as imagery distraction techniques. It could be calling her family, for example, for support. Okay. How would you evaluate the outcome of your interventions? Okay. Goal met if the pain was reduced to 2, for example, in a scale of 0 to 10. Goal partially met if the pain was reduced to 5 in a scale of 0 to 10. Goal not met if the pain was not relieved. Okay, so if you have any questions about nursing process, please ask me in class or you can email me. And thank you so much. I hope you find it useful. Thank you so much.